I'm Elliot Young, and I do sports medicine and non-surgical orthopedic injury management. The most common injuries that we see in sports are mainly sprains and strains, occasional fractures, and ligament injuries. We always advise our parents to help their children do an adequate period of warm-up prior to any exercise or any physical event. So something along the lines of 10 to 15 minutes stretching at the minimum, depending on the level and age of the athlete. We always encourage people to reach out if they ever have any questions about any injury. Certainly we want to maintain their relationship with their primary care provider, but in a lot of situations, musculoskeletal injuries are a little bit beyond what the primary care provider can handle. We're happy to jump in at that point if they need us. So if there's any question about an injury, whether or not it's getting better or whether or not it takes too long to get into their primary care provider, they can come see us. We'll see any sports injury within 24 hours of an injury. High school athletes in the summertime are often doing off-season workouts, doing weightlifting, and so in weightlifting we'll see sprains and strains. Sometimes we'll see some back injuries from weightlifting. But they're also playing 7-on-7 football, and so we see a lot of knee and ankle injuries at that time. So for high school athletes, stretching is even more paramount because they've reached a stage where their growth is a little bit more rapid and linear, and so they're getting taller, but they're still very tight. And so their muscular injury rate goes up a little bit. And in addition, they're playing sports with a little bit more velocity, a little bit more contact, and so they're at risk for other injuries, joint injuries, ligament injuries, things like that. So we advise really having a pretty good program of strength and conditioning and flexibility to try to be well-rounded so that they avoid overuse injuries.